These were the guys a week before, telling everyone the run for the hills, COVID is killing everybody. The numbers are totally off the charts and we have to now lock everyone in their homes.
Hospital death rate and the total death rate. It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference.
You just have to understand the difference. Well, why don't you tell us the difference? Because the news reporters and the papers and CNN and all these other guys aren't making a separation between those who have actually died of COVID-19 and those that have died of something else with COVID-19 on their death certificates. Told that it's all the same. This crazy pandemic is going on. But I'm going to give you the true understanding according to the Bible to what's happening here today. Elder Lawyer, real quick, we're going to jump in. Let's get Job. We're going to give you the insight to what's going on today, folks. This is the rise of the 10 horns. Babylon the Great has fallen. Okay? This thing is being controlled from the outside of America right now, all together, right up under your noses. This is an international, folks. This is an international run up to the mark of the beast being led through who? The 10 horns. America has fallen. I hate to shock you like that. It has fallen. But they can't allow people who are bearing arms all throughout the United States to understand exactly what's going on right now. They have to just slowly, incrementally, work on you, your psyche first through what you would call a psyop, and get you conditioned into what? Dying. It's like I would say, and I don't mean to. There's no pun intended in this because I'm going to show you they've been slowly putting our people down through morphine drips for a long time, and that's what they're doing now. Morphine drips. It's like some type of slow political morphine drip on all of Americans right now, slowly putting you down while telling you everything is okay. I'm just going to make you comfortable. How many times you've heard that about someone they're about to put down? Well, right now he or she is struggling, and what we can do is we can make them comfortable on their way out of this life. Politically, that's what's going on right now. Listen to this. Elder Lawyer, I need you to hear this, and then we're going to jump right in a moment. Elder Lawyer, I'm going to pull that up, but let's read Job 13 first.
The book of Job, chapter 13, verse number 4. But ye are forgers of lies.
Ye are what?
But ye are forgers of lies.
These people are forgers of
Nobody's ever
lies.
seen anything like that, where it's so contagious. You can
It's
be
straight source
feet away and just talking to somebody. and
Anytime
catch
they
it.
can put something on paper,
You can catch it.
it
You know
make
how
you
long it
believe
can
it's
live on
real life,
surfaces. So
real life
things that
death
nobody even thought
that
of,
none of
the
us are
level
seeing. Okay? And then right out tell you in your face that, yeah, by the way, your loved one probably died of something else, but the CDC just told us to put down COVID-19 as the reason for death. Don't tell me the love of many has not waxed cold, folks. How can someone just tell you they just killed your family, put them down through a morphine drip with no pushback at all? Can you imagine that? Can you imagine that? Years ago, there was someone in the hospital, and I went in the hospital, and I'm like, and I looked directly at the IV drip, and I asked the nurse, "What do you have in there?" "Oh, it's just some saline, you know, something, his fluids and all that." I'm like, "No." I'm looking, no, that's not saline. That's something else. Get the doctor up in here. They already told the family at this time to call the pastor down to pray in expecting their loved one to be put down like a dog. Okay? The preacher's already in the hospital. The family is already looking to, split whatever the person is about to leave or whatever the case is. And I'm looking at the morphine drip and I'm like, "Excuse me, doctor, what's that?" He says, "Well, that's morphine, to make them comfortable." I'm like, "So why don't you stop that? Why don't you stop the morphine drip?" "Well, we can't do that." Why can't you stop the morphine drip? The morphine drip is slowing down his whole body. His organs and everything is slowing down because of the morphine drip. And you should have seen him look at me as if I didn't know any better. And I told the family, I'm like, "Yo, if y'all don't get him off that morphine drip, he's out of here." This is what the doctor responds with, brothers and sisters. Because they'll make you believe that your family member on a ventilator or your loved one or your friend is in a coma. But what they're not telling you is it's a chemically induced coma. They're not in a coma. They're asleep. They're being put down. And you'll sit there and look at them, you hold their hands, you will be all right. I hope you can hear me. And the whole time you're talking to the person thinking they're in a coma, it's the morphine putting them down. The doctor looked at me and say, "Well, if we stop the morphine, he'll pull the trach out of his mouth. He'll pull the trach out." I'm like, "Well, Doc, isn't that a good thing? If he pulled the trach out, that means he's alive." I'd rather see him pull the trach out than what I'm witnessing right now. Talking about he'll pull the trach out. I'm like, that means he's living then, right? Folks, guess what? The trach was pulled out. Eventually the morphine went down and the brother was eating and drinking, sitting up in his bed, eating and drinking the next day. After they've already told the family he'll be dead in a few hours. Read that again, other lawyer.
Chapter 13, verse number 4. But ye are forgers of lies.
Forgers of lies. Now, notice it says you're forgers of lies in the book of Job. Speaking of the wicked. They're forging COVID-19 on our families death certificate. And using those numbers to do what? To announce to the world that black people are the carriers and the major issue when it comes to this disease that need to get dealt with, that needs attention, negative tensions towards. These people need to be tested. These people need to be stopped. They have forged, the Bible says they are forgers of lies. They have forged lies on death certificates. And guess what? No one out there is saying anything. And they are what, Elder Lawyer?
All physicians of no value.
They are what?
Ye are all physicians of no value.
Ye are all physicians of no value. How can you allow a separate entity, doctors, hospitals, to tell you what to put on a death certificate? Through all your years of practice in medicine, doctors are saying, I've never seen a separate entity, a CDC, tell us what we had to put on a death certificate before. They are physicians of no value, folks. They're only doing what they're told right now.
Dr. Fauci is on the Leadership Council for the Bill and Melinda Gates Foundation. In January of 2017, Anthony Fauci told a crowd at Georgetown University that there would be a surprise outbreak during the Trump presidency.
There is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak.
I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. Health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Well said.
Only doing what they're told right now, folks. Because why? If they're not in line with the pharmaceuticals and all that, eventually what happens? Their finances dry up. I heard they're getting this ridiculous number, like $13,000 per COVID diagnosis.
If someone dies with COVID-19, we are counting that as a COVID-19 death.
Now, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening.
That was from yesterday's White House briefing, and it sparked a nationwide debate over how we count deaths from COVID-19. Do we count someone who tests positive for the virus but died of pneumonia as a COVID death? But what about someone who dies with symptoms of the disease but was actually never tested? It's actually crucial information. COVID death stats inform the models that guide federal and state governments' responses to the crisis. It's really important. Now, Italy, very interesting, has been grappling with this same debate for weeks. I mentioned it 2 weeks ago. I'll mention it again. Here's what the Daily Telegraph reported. According to Professor Walter Ricciardi, is the scientific advisor to Italy's Minister of Health, This is what he said. He said, the way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many had 2 or 3.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on, the death certificate. I'm not going to add stuff just because it's convenient. I think that it's not a conspiracy theory at all.
Yeah. So you reject what he said?
Absolutely.
Even if there's no test. If they put it on the paper, $13,000. Just to say that someone has COVID-19. Now imagine in the hood how people running into the hospitals and all that, what's going on there. Being labeled COVID-19, and then the news going to take that information and begin to say, listen, there's something we have to do. This disease is just tearing the black community apart.
American population is 14%.
We need to do something.
But the number of African Americans
with these bloviated numbers
virus is 40%.
Where are your pastors?
We should hire 3 or 4 colored ministers, preferably with social service backgrounds and with engaging personalities. The most successful educational approach to the Negro is through a religious appeal. We don't want the word to go out that we want to exterminate the Negro population. And the minister is a man who can straighten out that idea if it ever occurs to any of their more rebellious members.
And they are physicians of no value. You think Christ would just sit back and not point out the wickedness and shine a light? You think Christ would, if Christ was here right now, you think he would sit back and without shining a light on the wickedness and the darkness that is destroying the children of Israel? These pastors sitting there. I heard there's a pastor somewhere. I was on the phone the other day. I'm trying to reach out to a brother, trying to call and get to this guy. He's sick with something. And I'm trying to get with another brother and say, man, you better get him on the phone with me because, hey, if he has faith in this system, they're going to put him down. But you have pastors who believe this stuff, who have more faith in what the news people, the talking heads are saying through a teleprompter than the words of God, than the words of the Most High.
Stay low. Tell me mama, stay low. Until you doing what I'm doing. Can you tell me why this was so wicked? Can you tell me why them demons tryna get me? Can you tell me why my people they're so lost? Can you tell me why we praying to a cross? Because we left the Most High to follow heathens. Because we popping all these perkies for no reason. My people destroyed for a lack of knowledge. Now we in religion following false doctrine. Make believe.
our people. How you gonna preach in the church and they putting the Sabbath first? We gotta put in the work and follow a highest word. You might lose the ones you love, and this walk is gonna get tough. Hey,
can you tell me why this world so wicked, wicked? Can you tell me why them demons tryna get me? Can you tell me why my people they're so lost? Can you tell me why we praying to a cross?
because we left the Most High to follow heathens. Because we popping all these perkies for no reason. My people destroyed for a lack of knowledge. Now we in religion following false doctrine.
I was lost, yeah, I was lost. Never knew the truth, now it's on. Keeping the talk, now the lies is filling up. 12 tribes is raising up. Got the enemy scared of us. Yeah, gotta keep walking, gotta keep seeking true doctrine. Commandments left on the earth, laws are not done away with, they come first. Let's get back to the oracles. I was talking rewind, we're going through portals. I'm just seeking the truth. I'm a priest to the Jew and the Greek get it too. Yeah, I know times getting hard. Yeah, I know times getting hard. But it's time to wake up and get back to the truth. No more sleeping, no more cool. Can't fall, can't lose. Gotta go by the rules. With that said, I salute. Can you tell me why this world so wicked, wicked?